Hello everyone. In this session, I will discuss foundation of bioethics and it pertains to phase 2 MBBS. Here I will discuss the role of autonomy and justice in paternalistic versus human right approach. Earlier, doctors did what was considered by him as best for the patient. However, with the evolution of the time, understanding and availability of more information to the patient, the role of patient changed from a child to an adult who had information and right to information. So currently we use human right approach in which patient is given right and autonomy to best options suitable to him. Doctor honors and respects their decision. In World Medical Association Declaration from Geneva, it is written, I will maintain the utmost respect for human rights. I will not use my medical knowledge to violate human rights, civil liberties, even under threat. And therefore, doctor has to respect the autonomy. By autonomy, we understand a personal independence or freedom to determine one's own action and behavior, and this can be in the form of a right to take personal decision to choose any of the options are available for the treatment for his suffering or ailment or any other intervention available, and a decision which is independent of extraneous influences. Consent and shared responsibility becomes easier when patient's autonomy is respected, and therefore all doctors should respect the autonomy of decision making of the patient. It is obvious that patient should be communicated very clearly about the details of the illness, treatment options and risks associated with intervention so that he can take informed decisions. Very important. Now, patients are now empowered. They become partner in the management of their illnesses, and this shares the responsibility. The role of caregiver is to facilitate this informed decision making process. This principle of respect of autonomy forms the basis of consent and confidentiality, which are vital for ethical practice today. Even when a doctor may disagree with the decision, he has to respect the patient's autonomy. For example, a pure vegan may refuse to take a medicine because it is derived from animal source. Either doctor has to provide an alternative medicine or he has to respect the patient's decision. Exceptions to autonomy are there. For example, in emergency unconscious patients or when patient is unable to decide because of poor mental status. Several other factors, for example, gender, literacy, age, social taboos, compromises with the autonomy and decision taking becomes more complex to the doctor under such situations. Now, there are exceptions such as exposing other patients to communicable diseases. For example, during COVID-19, isolation was needed, but if patient refused, then autonomy cannot be accepted or honored. Similarly, committing acts of violence or suicide, autonomy cannot be respected. So these are the exceptions. Now, doctor also has autonomy to take a professional decision in the best interest of the patient, which is independent of external influences. However, there are times when this autonomy is also jeopardized. Another related term is therapeutic privilege. In an unusual situation, a doctor may decide to temporarily withhold information to the patient, because by divulging this information, the physiological or psychological condition of the patient disease may worsen. One example could be, if elderly mother develops acute myocardial infarction, whereas his son has already died, so it is better to inform mother that some problem is there, but not it is that is a serious large acute myocardial infarction, because it will again jeopardize and put her under greater stress. Now, second principle of the bioethics is justice or equitable justice. Aristotle stated justice as giving to each that is his due. Fairness and non-discrimination in medical practice is the principle of equitable justice. Social and economic inequalities should not prejudice the doctor to make choices for treatment. One treatment for rich and other for treatment for poor for the similar disease is not equitable justice. Therefore, every sick individual has equal access to care. The same principle applies to resource allocation in deciding health policies, that is rationing of the limited resources. That is called as distributive justice. All these two play very role in adequate patient care. This will provide a level field for opportunities to all individuals. It would be unjust not to inform about risk of radioiodine therapy to a young childbearing female and starting treatment. So that is again not professionalism but malpractice. Now, consent is an important component of autonomy of the patient and shared decision making by the doctor-patient. Now, valid consent is one which is given free of coercion, is voluntary and well informed. Implied consent is one when a patient approaches the physician for diagnosis and treatment, it is implied that he has consented for physical examination and drug administration. In the hospital setting, informed consent is always taken before invasive tests, procedures, and surgery. Another variety is express consent, a clearly stated verbal or written consent, but verbal can create a lot of the disputes later on. So it is always better to record or write the consent. Invalid consent is one when a consent is given by coercion, fraud, undue influence, mistake, or misinterpretation. It is considered invalid under Indian Penal Code Section 19. If a patient is treated without a valid consent, the doctor is liable under law of tort and criminal, considering it an assault. Therefore, taking consent is very important part of medical practice. An informed consent is important outcome of an effective communication and respect to the patient's autonomy. Every patient expects information about disease, its outcome, treatment options, and their consequences. Once patient and doctors are fully satisfied, only then an informed consent is taken before beginning a therapeutic intervention or surgery. It is usually a written informed consent. It should be recorded as far as possible. It is essential prerequisite for clinical trials, and no patient or no participants of trial can be given any drug without his or her consent, and this consent is written informed consent in a form called as written informed consent form. It is usually taken before administering anesthesia and doing surgery in hospitals. Patient should be in a state of sound mind and capable to give informed consent, and that is patient should be competent. Minors and elderly with dementia cannot give informed consent, so a legal representative or guardian is chosen. Components of the informed consent are: patient should know details of the disease, need for further investigation, nature and course of the disease and possible complications, therapeutic options available, risks and benefits of the treatment, consequences of non-treatment should also be discussed, cost and duration of treatment should be discussed, expected outcome of therapy should be discussed, and monitoring required and follow-up required should be discussed. Before and when they are discussed, they should also be in the informed consent form which patient has to sign or patient's representative has to sign. It should be in a language which patient can understand, avoiding complicated technical jargon. If I am from Hindi speaking area, informed consent form Swikriti Patra should be in Hindi. That is, suggested questions as short notes could be describe and discuss the role of autonomy and shared responsibility as a guiding principle in patient care, or it can be describe and discuss role of justice in patient care. There could be a short note on informed consent itself.